Hold on. Which country is the biggest climate polluter on planet Earth? You have no idea. You're a protester and you're utterly ignorant about what you're protesting about. What's the answer? Okay, so he doesn't know. He's literally protesting about climate and he can't tell you who the biggest polluter on planet Earth is. And he won't. What country is the largest polluter on planet Earth today? Okay, so this young lady has no clue. She said the United States of America. She's protesting, and she has literally no idea. By the way, the answer is Communist China. Which country leads the world in reduction of carbon emissions? Do you know the answer to that? I'll give you a hint. It was the wrong answer you gave before. It's the United States of America. Do you know why? The reason is because of the thing you're protesting against, fossil fuel. No, you're so ignorant you don't know. So if you're going to protest, confront some facts.
Dear those who munch on this channel, yes, that's you, and you over there. Your mission, should you choose to accept, is to get yourself to invite more people along to the 24/7 Eyes channel. Please get them to subscribe any day between Monday to Sunday before 10 p.m. November 5th. For daily roasts with a political option and extra room for those wanting Dems on board. There will be gossip, banter, and funny bits to be shared every day as the British outsider Tony delivers non-stop what he's found round from America's political bag. This message will self-destruct and end in 3, 2, 1.
Well, the president was clearly comfortable discussing foreign policy issues from Ukraine to China, but he did mix up Vice President Harris and former President Trump's names mere minutes into the event, just hours after mistakenly calling Ukrainian President Zelensky President Putin. Welcome back. One group that's happy with how President Biden's news conference went last night, Republicans, especially those around former President Trump.
Rambling about. Take what he's been talking about. Hannibal Lecter, he says, is a nice guy. Trump would rather be electrocuted than eaten by a shark. You know that whole thing? Remember that? Poor Donald. He can't even watch TV this week because it's Shark Week. And by the way,
I'll say this very clearly. The one thing with Biden, if there is one politician who understands about overcoming adversity, you know, carrying on when it gets going really, really tough. I mean, they were attacking his wife on Monday, by the way. On Monday, Fox and Fien said, breaking news, Jill Biden is a wife, Jill Biden is a mum, Jill Biden is exercising her right to an opinion. No news on Melania Trump because I just said it's a different set of rules. Where do you think this is going to all go? Comment section now, please.
we've never seen anything like this. And it's not a joke. It's time for us to stop treating politics like entertainment and reality TV. Another 4 years with Donald Trump is deadly serious. Deadly serious. His proposals are deadly serious.
Senator Cassidy, floor is yours. Thank you, Chair Sanders, and hey, thank you all for joining us today. Incredibly important topic. Really appreciate it. I'm a physician. I worked in a hospital for the uninsured for 20 or 30 years. I've been at the bedside where I've had to tell someone they've got a terrible disease in which they may have hope, but nonetheless it's going to be tough, or maybe in some cases the diagnosis is more likely than not fatal. The last thing you want them to be concerned about is medical debt. That is a burden which they need not have. So we've got to address medical debt. But in medicine, we have a saying, don't just do something, think. We have to think about what is causing this. As you think about it, the medical debt is a symptom of a larger problem, the high cost of health care. What is driving that? If we address that, then we will kind of, along the way, address the issue of medical debt. Not entirely, substantially. Right now, Americans pay more for health insurance than ever before. On the Affordable Care Act exchanges, the average monthly unsubsidized insurance premium on a silver tier plan is $483 for a 40-year-old. For a family of 4, the average unsubsidized is $1,600 per month, and the average deductible is $5,000. So this is the amount that the patient is paying before they benefit from the plan. So this kind of coverage is oftentimes unaffordable, and this is what can lead to medical debt. We have to examine where patients are taking on this debt. Data shows that hospitals are responsible for more than half of medical debt. That's important. Congress has long provided additional resources and support to hospitals to help cover the cost of a patient who may otherwise be unable to pay. Many federal grant programs are available to hospitals in financial distress to ensure that they they should be able to continue to be helpful to those who are unable to pay. One example of this is the 340B program, where hospitals are able to bill full rate for a drug which they acquire at a sharply discounted amount. And the idea is that they would use that delta, that profit, if you will, to help the patient. But there's other examples too. The disproportionate share program, or sometimes the upper payment limit program, as well as a nonprofit and tax-exempt status for many hospitals. There are a lot of resources out there for that 50% of the medical debt, which is contributing to the problems that the chair just spoke to. Speaking specifically about 340B, hospitals participating in 340B get substantial discounts on prescription and oncology drugs, but it is unclear if these discounts are actually being passed to patients. Since last year, I've led an investigation in how different healthcare entities are using this 340B revenue. The chair has declined to participate, but it's an important topic to consider if we're going to address both a root cause of medical debt and, two, why are the things that we're putting out there that may potentially address this not addressing it? If we just put in one more program which is poorly implemented, we're going to be back in this hearing 5 years from now. We've got to see how the ones we've already done are actually working. Don't just do something, think. So I'll also point out that it's been proposed that we just cancel all medical debt. My colleagues on the other side of the aisle suggested that. But to be clear, a one-time cancellation of medical debt is not a solution. It is a Band-Aid approach for a one-time problem that's going to come back. Don't just do something, think. It also shifts the debt upon taxpayers and upon those who, we think it's free. It's not free. If people haven't noticed, we've got this incredible debt and deficit in our country. And that's going to weigh upon our children and our grandchildren, upon these young interns who are here. What about our obligation to them? Don't just do something, think. Well, may hear today about Medicare for All, it's been mentioned, but I'll also say that a healthcare system in which you think it's free because the taxpayer is footing the bill, you've never seen how expensive something can be until you perceive that it is free. This committee has a long history of engaging in real bipartisan efforts to ensure that our healthcare system works better for patients. Just last year, the committee passed the PBM Reform Act to address malaligned incentives affecting PBMs and the price patients pay for their prescriptions. We need that signed into law. That would be a way to begin to lower the costs for patients. There's other examples, too. I look forward to exploring them. I thank you all for being here. You represent a spectrum, but this country is a spectrum. And so, ideally, we're going to learn from you the kind of width and breadth and depth of that which we can do as a government to help reduce medical debt for all Americans. Thank you. I yield.